Okay, and we have Takiela here with us today. Takiela, it's so nice to meet you.
Likewise.
Thank you for joining us for our CHW Day podcast. We can kick things off with you stating your full name and the current organization that you work for.
So my name is Takiela Walker, and I'm a CHW, certified CHW with the Carmela Rose Health Foundation.
Okay, wonderful. Is there anything you'd like to share about the Carmela Rose Health Foundation?
We are a very tight-knit group. And we get along very well, and we work very well together in the field. We go out into homeless shelters, halfway houses, treatment centers, and help people navigate those systems that they need the most help with.
Wonderful. And the big question, what is your why?
Ooh, I know sometimes they say if your why doesn't make you cry, it's not big enough. But for me, it's being the best part of someone's day. For me, because you meet people in all different states, mentally, physically, and they may not be having the best time. You don't know where they just came from, what they're walking into when they leave the space that you're in. But what you can control is how they feel and what happens during the time that you have them. And I just want that to be the best part of their day, because we're walking alongside of them. We're not carrying everything for them. Mm-hmm. So I think also just managing expectations is kind of part of why I do this. And it's deepened over time. The longer I've been doing this work, it's changed. You know,
that was my next question.
Yeah, it's changed. When you first start out, it's kind of like, oh, I want to get all the resources. I want to do all the things. And then sometimes you realize that a part of managing those expectations is you completed a form. You got them to complete the application, and it's submitted now, whereas before they've tried 4 or 5 times already on their own and they couldn't do it. But just sitting with them in that space and letting them know they're seen, they're heard. And that's why. And it just deepened, and it keeps getting deeper the longer I do the work.
That's amazing. It does sound like you definitely found your absolute why, then if it just keeps getting deeper over time too. And I think we find that a lot with our CHWs. There's so much passion into the work, and
there has to be
so much passion for helping others, and empathy too, I think is a very common theme. So what type of advice would you give to someone who's interested in taking this path to becoming a community health worker? I
would say you just said compassion, maintain compassion, maintain self-care. We talked about that earlier. We've talked about that all day today. Understanding that boundaries, is a part of all of that. And just managing not only their expectations, but your own. And just helping them, like I said earlier, realizing that even one small step is an accomplishment, and progress isn't always perfection, but the progress, as long as it's moving forward, it's successful.
Do you have any grounding rituals that help you as part of your self-care?
Yes, being an introvert, it's very hard work for me, because I would rather be at home in my room with a book, but that's not helpful. So for me, it's meditating, even if it's just taking a silent moment before I get out of my car to go into a work site. Or, taking a deep breath in between helping one person before the other one sits down in front of me.
And those are real, actionable, accessible tools that anybody can use. So those are really good tips. So I'm glad that you're able to integrate them too.
Thank you.
Well, thank you so much for sitting down with us today, Takiela. It's been great to get to know more about you and the work that you do.
Thank you.
We really appreciate you being here for CHW Day.
Thank you for having me.
Thank you so much.